Dr. Phan, you're a doctor of family health, specializing in nutrition and exercise. Is that correct?
Yes.
So tell us a little bit about yourself, including your career and current role with Brigham Health.
I grew up in Vietnam. I graduated from medical school in Ho Chi Minh City in Vietnam before I relocated to the States. I completed my residency training in family medicine in Beaver, a small suburb in Pittsburgh, Pennsylvania. I worked for Bethesda Deaconess Medical Center for 14 years before I joined Brigham and Women's Harbor Medical in February of this year. I have special interest in taking care of pediatric patients and promoting healthy lifestyle for my patients and their families.
When we talk about family medicine, which is different than, let's say, other primary care physicians, what's the difference?
The primary care physicians include pediatricians, internists, and family physicians. Pediatrician sees patients from newborn up to 18 years of age. Internist sees adult patients 18 years and older. Family physician sees everyone from infancy through elderly.
What are some of the biggest health challenges that you see when you're working with families today, especially during this pandemic?
Well, there are many challenges that our families, patients and families are facing during this pandemic. Fears and anxiety about new disease and uncertain future can be overwhelming and cause strong emotions in both adult and children. Public health actions such as social distancing necessary to reduce the spread of the virus can make people feel isolated and lonely, which can increase stress and anxiety.
What are some things that families can do to improve their overall health?
Coping with stress in a healthy way will make family, patients, and people you care about and community stronger. There are healthy ways to cope with stress. I recommend the family to take care of your body, take deep breaths, do stretching and meditate, try to eat healthy, exercise regularly, get plenty of sleep, and avoid excessive alcohol and drug use. Do something you enjoy together as a family, such as walking together, hiking, biking, swimming, and talk to people about your concern and feeling. Only talk to people that you trust and get help immediately if you are in crisis.
How important is nutrition and exercise in your overall family health?
Well, I can't emphasize enough the importance of nutrition and exercise. Creating healthy habits for your family is of the utmost importance.
Some of these changes that we do to improve our family healthy habits, for example, do we eat smaller portion sizes? Do we perhaps put more emphasis on vegetables more so than meat proteins? What are your thoughts about that?
So I recommend the family to try to eat more fruits and vegetables. Half of what you eat is supposed to be fruits and vegetables. Drink plenty of fluid and make meal prep of family activity together, and serve a variety of food in a small portions. Eat meal together and have great conversations. Create no phone zone at home and turn off all the devices when together. And get outside and play together.
So exercise is really important?
Yes, exercise is very important. It helps reduce stress, prevent overweight, boost the immune system, and improve sleep.
At what age should we start healthy family habits? And is it too late if we're over a certain age?
I think we should start healthy habit as early as toddler age. And how much physical activity you need depends on your age. It's never too late and it's never too early. 18 to 64 should do at least 2 hours and 30 minutes each week of aerobic physical activity at a moderate level or 1 hour and 15 minutes each week of aerobic physical activity at a vigorous level. Spreading aerobic activity out over at least 3 days a week is the best. And adults should also do strengthening activities like push-ups, sit-ups, and weightlifting for at least 2 days a week.
Dr. Phan, I've always admired those who practice Tai Chi.
Yes.
Are you familiar with that? And what are some of the health benefits of Tai Chi?
Some typical physical activities are especially beneficial, depends on the age. Balance and stretching activities enhance physical stability and flexibility, which reduce risk of injury, including fall, and are important in elderly. So Harvard Medical School sponsored a research involving adults with Tai Chi at my previous practice, and they found that it reduced the fall rate in elderly people.
See, that's an great example of why I definitely want to make sure I take up Tai Chi the first opportunity when I get outside in good weather. Is there anything else, Dr. Phan, that you'd like to share with us?
Well, I recommend everybody to try to eat healthy and exercise, and start as early as possible because it benefit your children their whole life. You start early, and children, they learn from who you are, what you are, more than what you teach them. So you try to be a good role model for children. So start eating healthy, exercise regularly, having healthy habits, and involving all family members as much as you can.
Who influenced you to decide to become a doctor?
Thank you so much for this question. When I was young, my mom always wanted me to be a doctor because she said that, we need one doctor in the family. Unfortunately, at that time, my younger brother died from viral illness when he was only a few months of age. And since then, my mom put the idea in my head that I need to be a doctor to help the family.
We're in the middle of the pandemic, and people often refer to as like the pandemic 20 or the COVID 20, which basically means that they've been putting on as much as 20 pounds. So what advice do you have to the families in terms of how to eat in a healthy way as we go through the remaining months of this pandemic?
I recommend the family to focus on healthy choices. Make sure that you eat more fruits and vegetables. I understand that when the kids are studying from home and there's snacks available everywhere, I recommend the family to pick healthy snacks, fruits and vegetables, and cut down unhealthy snacks, and cut down screen time. Now, most of the kids spend all their day on computer learning from home. So make sure that they are moving after that. They have to shut down their devices and do some activities. They can, jumping, running inside the house, doing some activities, or do Zoom exercise. There are so many Zoom exercises that you can do for free, and also on YouTube video that the family can do together as a family.
That's great tips. Thank you so much.
You're welcome.